I just wanted to remind everybody to please mute your audio. We will be recording the presentation. And then we will have questions after the presentation. So if anybody has questions, please hold them till after. And then we'll also have an evaluation link for everybody. We'll put that in the chat box after. And today's presentation is on Indigenous evaluations and good health and wellness. And our presenter is Brad Kruger from ACET. And so Brad, whenever you're ready.
Hi, this is Carlos from ACET checking in.
Hi, Carlos. Welcome. Thank you. Thank you, Emily. And as she shared today, we're going to talk about Indigenous evaluation, which I know we've talked about previously on both calls like this, as well as at the Good Health and Wellness Symposium. So I hope to take a bigger chunk of the time and dive into some of the evaluation products and reports that have been developed, so you can kind of see the second half of the work that you guys are all doing on the ground. So that's kind of where we're headed. Again, my name is Brad Kruger. I work as an external evaluator alongside the Good Health and Wellness team at the Great Plains Tribal Chairman's Health Board. And so I've got maybe 30 or 40 minutes that I'm going to walk through a few different pieces that are kind of core to evaluation, and specifically Indigenous evaluation, and then dive into some products. I am up for questions kind of throughout, so if you've got questions, feel free to raise your hand. Otherwise, we'll definitely have some time at the end that we can dive into specific questions. So again, we'll start with kind of Evaluation 101. If you've never heard of it, what is it? How does it work? What are the different types of it? And then we're going to take 5 to 10 minutes and walk through 3 guiding documents that are really core to evaluation, and much of that's going to be familiar to all of you. Let me share my screen. I see Jennifer typing me a note. There we go. Now you can see my screen. It's no longer frozen. So we're on the agenda page here, 3 guiding documents, kind of the structure of evaluation. Then we're going to dive into this specific project, right? Good Health and Wellness. You've probably seen some of the graphics before, and you hear names like External Evaluator, ACET, UIHI, CDC, Evaluation Framework, Indigenous Evaluation. So we're going to try to put some context around those different pieces so we all understand some of the moving pieces. And then we're going to dive into some of the products developed by CDC, developed by UIHI, that's Urban Indian Health Institute, as well as products developed by ACET that you guys have probably seen previously. And then we'll save some time for questions. So off we go. Evaluation. So what is it? People talk about evaluation in a lot of different ways. This is maybe just one snapshot of the way that I think about evaluation. As kind of 3 separate components, right? So you've got the developmental side, you're exploring, you're creating, you're emerging, you're understanding and beginning to think through what your program might be or what your curriculum might be. You're looking around at different pieces, and so you're describing what is your program, what are those 4 pieces. You've got formative evaluation, where now you've got a curriculum, you're implementing, and you're tracking the things that you're doing so that you can improve it. How is it working? What's working? Where are we getting people to show up? Where aren't people showing up? Is this message getting out in the way that we thought it was going to? How are we connecting with our communities? And so that's the formative evaluation. That's while the process is happening. It's over the course of the year or 2 that you're doing the actual implementation, you're running the program, right? And then the third, the piece that we all strive for, is the summative piece. So you've got an established, mature program, and you're hoping that it's predictable, right? You're hoping that the activities that you're doing today are going to generate outcomes tomorrow or next week or 3 years from now. And so you track things like who's eating healthier, whose knowledge has expanded, who's lost weight, who's exercising more, did it work, right? Did that program that you spent time thinking about, spent time implementing, what difference did it make? You know, did it work? And so that's the summative piece. And so as we think about evaluation, we think about it through those kind of 3 different lenses of developmental, formative, summative, and each are appropriate and each are involved at different stages of your work. And so you may remember back to the first years of Good Health and Wellness when we did a lot of assessment, right? We began to understand what was out there, who was doing what the needs in the community were, And then we took that information and we thought, okay, let's start implementing. Let's start doing some programmatic pieces and begin to feel out the community, where they're resonating with, forming the program, if you will, building and improving on what you know, and then beginning to understand that through some data collection and reflection, and then ultimately summative, right? As you get to the end of the year, as you get to the end of 3 or 4 years, what policies have been implemented? Who's exercising more, who's lost weight, right? So now you've done those elementary pieces, you've taken those first couple of steps, so now you can look to see if it worked. So those are kind of the 3 big buzzwords that I think about as we think about the types of evaluation. As we continue on, then we think, okay, but how does that actually work? What are we actually going to be doing? Oftentimes, evaluators get pegged as this person sitting off in this ivory tower off in a higher education institute, crunching numbers on some giant screen for hours at end. And there is some evaluation that is that way, but for good and health and wellness, we've really tried to capture the journey of your project. Again, in those same similar frameworks of what's being done and who's being impacted of it. Evaluation depends on feedback from others, right? So we can track certain metrics. We can track how many meetings, we can track how many attendees, but really the core of evaluation, especially when we think of formative, which is where much of this program lives, involves talking with the people who are impacted by your program, so those community members showing up to your events, those stakeholders involved in your program, but also those implementing the program, right? No one knows better than you, the program coordinator, potentially in this role, what's been done and how it's going. And so you probably often hear from us asking how things are going. That's why we always ask to fill out the webinar link at the end of or the evaluation link at the end of these webinars. That's why we conduct those interviews. That's why we ask you to fill out those progress reports, because it helps us reflect on the program and understand what's happening, maybe what's not happening, what different grantees are doing things differently, and where some of those areas for improvements as well as those successes lie. The other thing specifically with this project is, and many evaluations, is we work very diligently to honor cultural values and beliefs, right? If we come in and we do the same evaluation in Indian country that we're trying in, let's say, suburban Chicago, it's got to look different, right? The communities are different, the contexts are different, the types of programs, the resources, the traditions, the cultures, the values, they're all different and unique. And so how do we tailor these traditional evaluation methods in order to make them appropriate for use in a project like this? And so one way that we've worked to do that is to embed the Indigenous evaluation framework in much of the work that we're doing. And so you've probably heard that term a few times. If you were at the Diabetes Roundtable, you heard me talk at length about that. It's the idea of kind of understanding and creating this story, of establishing a framework, understanding your community, and then beginning to weave this basket of what are these pieces that are influential within our program, and how are they impacting each other, how are they impacting the community, and they depend on 3 primary sources of knowledge, right? So applies knowledge from the community. So we have traditional knowledge that passed down through stories and tradition, right? Those things that we know because of the cultural heritage of many of the tribes and organizations that you all work with. We talk about empirical knowledge, those things that we're looking at, we're observing, we're seeing people exercise, we're seeing people out in the farm, out in the garden working, whatever that may be. And then we have revealed knowledge, those things that come through spiritually. And we work to implement and understand each of those sources of knowledge in the evaluation so that we can best understand how the program's interacting. And so we do that in a variety of ways. We do things like track metrics, right? How many meetings are happening? Who's been connected with? What are the differences made? But then we do things like connect with you guys and do the interviews and understand the stories of what are those pieces that might not come across in a number, but might come across in a story that are really the heart of this project. And so again, we go back to that idea of capturing the journey of your project and spend some considerable time considering how to do that. And so that's a little bit of evaluation. How does it work? 3 primary tools, and I know this is my second set of 3, so that's my fault, bad presentation, but 3 primary tools that we use. We have the logic model, we have the evaluation plan, and then we have the implementation / the data of what we done. And so you've heard these things. I personally have talked to many of you about these things throughout the 5 years of this project, right? The logic model is the backbone. It includes what we're going to do, what we hope comes out, and then 3 years from now, what we hope those results are. It's often developed in advance or at the outset of the program, and this one was, right? From day one, we said, what are we going to do? What do we think is going to happen? And then how can we look for those outcomes at the end? And that's what the evaluation plan does, right? You've got your program logic, your rationale. If we do X, we hope Y will happen and generate Z as a change in the community. So then the evaluation plan says, how do we measure that outcome? How do we see if people are actually exercising more or eating more fruits and vegetables? Well, we do things like ask them, we interview them, we track how much fruit's going out, how many webinars we're hosting, how many policies are passed. So the evaluation plan really gets into the nitty gritty, right? It's the plan of, okay, Jennifer is going to do this activity. She's going to collect this data by early January. And then she's going to do this to analyze and or summarize it. And that will help us reflect back to the logic model and say, did we get what we thought we would? Did what we put in generate the outcome that we thought we were going to? And that kind of transitions into the last step there, where it provides the information. It allows us to answer those questions. So we thought if we hosted a health fair that we would get 100 people to show up and 10 of them would agree to join the walking club. So let's put an evaluation plan together of saying, okay, how many did actually